Hello, my name is Dan Hurley. I'm with the Risk Management Division. I'm the Risk Manager for the City of Chesapeake. And we're here today to talk about training for the Virginia Occupational Safety and Health Requirements, which is additional training today for the high-risk exposure employees for COVID-19. And with that, let's start our slides. First of all, we're doing the introduction for the high-risk level job tasks. As you recall, VOSH, which is the Virginia Occupational Safety and Health Emergency Standard, requires classification of job tasks by risk levels. And specifically today we're talking about the high risk. As you know, there's 4 categories: very high, high, medium, and lower. But this section we're going to talk about those of you in the high risk classification. As part of the introduction, the city employees that we have in the city of Chesapeake are typically classified in 3 of the categories: high, which we're talking about today, medium, and lower. So this is to comply with the Virginia Occupational Safety and Health training under the Emergency Temporary Standard. So the focus of this training, again, is on high risk. We're going to follow the city's implementation policy to comply with the VOSH standard. We're going to identify the high-risk job tasks associated under high-risk jobs, and we're going to basically look at exposure risk for those high-risk positions. And then also we're doing mitigation. We're doing mitigation through engineering, administrative procedures, work practices, and personal protective equipment, which are referred to as PPE. The essential topics we're going to cover today that you've already reviewed in prior training include characteristics and methods of transmission of the SARS virus. We're going to talk about signs and symptoms, which you've already had a review in the prior training. We're also going to talk about risk factors, which you've also had in prior training. And we're also going to discuss a little bit more about the pre-symptomatic and asymptomatic individuals who could have COVID-19 and transfer the SARS virus. Methods of transmission, which most of you know about. The main transmission is when an infected person coughs, sneezes, or talks, basically putting droplets into the air. They could be consumed or breathed in by another individual. Close contact with someone who is positive for COVID, or you could actually possibly get an infection from some of the droplets that could actually survive and exist on surfaces for several days. Part of the challenge we have is asymptomatic individuals. The CDC estimates that 35% of those people with COVID-19 are asymptomatic, showing no evidence of the disease. Like bloodborne pathogens, those of you that are in high-risk positions such as fire, police, EMS, you've used universal precautions for pathogens in the past. So just like pathogens that are universal precautions that are required, every individual must be considered a potential carrier. All requirements of a hazard assessment are enforced whenever we're in close contact with another individual. As far as the high-risk hazard assessment classifications, as we talked about before, as you look onto the right to the pyramid, you see there's very high, high, medium, and lower risk. Very high risk is considered those doing intense medical procedures where there's aerosolization of body fluids or products or respiratory droplets. But we're typically considered for this training high risk, and it's typically public safety, people performing medical procedures, or work requiring high potential for exposure with close physical contact, such as someone giving a physical, maybe giving someone an inoculation. Medium are those people that might be within 6 feet of another person or work crew, but typically not very invasive. Lower is those people that can typically maybe work in an office or maybe remote, and they're generally not going to be within 6 feet of another individual, or they can actually practice social distancing. Talking about the high task risk classifications, the high risk level of exposures. Again, those are those where you generally have a close contact within 6 feet of a person who could be known or a suspected source of the SARS virus. Examples, of course, are hospital workers, particularly for the city of Chesapeake, first responders, medical transport individuals. They even talk about mortuary services under the classification, medical, dental staff, non-medical support staff, healthcare settings, long-term care facilities, and home health care. These are actually, the classifications are brought to us by VOSH. VOSH has actually made these classifications on the 4 different levels, and this is the classification particularly for the high-risk individuals. Again, they require specific work procedures, which is why we have hazard assessments, which are required. Now, if you're within contact of a known or suspected person, typically the types of exposures you would have would be those that are providing medical services, perhaps medical treatment. Could be that you're having contact with a resident or inmate that might be in quarantine. You may be required to have close contact as a police officer, for example, either addressing a member of the public or, unfortunately, in an arrest procedure. And there are situations where, particularly in the area of public service, as far as individuals that are involved with protective services, you may have the inability to strictly have social distance, have strict social distance. So again, that's why risk mitigation will require additional procedures and personal protective equipment. Some of the high job tasks identified in the City of Chesapeake are those in fire and EMS, police, CIBH, Health Department, and the Sheriff's Department. The high-risk individuals have are required to have hazard assessments that are developed. They're conducted by designees within the department, typically your safety officer or your designated health officer. They identify specific job tasks. They identify the hazards associated with those job tasks. They identify work protective equipment requirements or procedures or personal protective equipment. They also require employee input, which is part of the VOSH standard. That's very important that we have input from employees about the hazard assessment. Also, those results of the assessment must be communicated to employees so they have a clear understanding of what's required. And it gives them the opportunity for feedback. The hazard assessment is required, and it has to comply with the VOSH Emergency Temporary Standard. So as you can see on the far right, there is a hierarchy of controls from elimination, substitution, engineering controls, administrative controls, and personal protective equipment. So part of the hazard assessment, one of the main parts of the hazard assessment, is to determine safe work practices or protective measures that can protect an employee from contracting the SARS virus. So typically, when we say hierarchy of controls, we're basically looking at, in this case, for engineering controls, administrative controls, and PPE. We'll talk more about that in the next slide. Here's an example of the hazard assessment itself. The form on the right is the VOSH standard form that's used to basically develop the hazard assessment. As you can see, it has the listing of where the specific task is listed at the top. You have to identify the risk level, and as you can see on the form, they're from high to lower. So that has to be actually marked as to which hazard level it is. In this case, we're talking about high risk. And then you would have, in the next box, you would see where we have the description of hazards. And so this would outline the exposures that the employee may have performing that particular job function. Next box over would be engineering administrative controls, and those are the things that we do basically to reduce exposure to the employee. It could be such things as design, mechanical systems in some cases. Administrative controls could be work procedures, which we'll talk a little bit more about. And then the final box on the far right would be where we put personal protective equipment. And as you notice at the bottom, it has to be signed by the designated health officer within your department. Some examples of engineering controls typically would be HVAC systems, which have to be maintained properly to make sure there's adequate air changes in a building. Another example would be those that use negative pressure systems, where, for example, in a health setting, you might have a specific room that actually has air changes for such individuals with tuberculosis or some other disorders requiring a higher frequency of air changes and air movement away from the individuals. And they're also frequently calibrated. Other engineering types would be where you have separation panels or walls to basically separate individuals from each other, providing more isolation. And you may also have a design to restrict the building of physical access, where you can reduce density and travel. Some administrative controls, some examples. The most typical that we are using today are involving wearing masks for all employees who would enter the workplace, as well as visitors who we offer masks. We also are required under the VOSH standard for high-risk employees to do employee screening prior to the shift, and that's every day. Practice social distancing, lowering room density, such as where we have places where people would normally congregate. We basically restrict the number of people in those rooms. So again, the goal is always to maintain 6 feet of distance when feasible. So part of the hazard assessment, we talk about PPE and protective measures. Again, we're always trying to make sure people wear face masks or face covering within 6 feet of another individual. Wearing a respirator when necessary, and we'll talk more about respirators in a minute. Gloves in certain situations, face masks, dressing gown covers could be required, particularly in public safety areas such as EMS, and also that we provide hand sanitizing material and/or opportunities to wash your hands. Reducing size of work crews that work closely together is another administrative control, which could also be when traveling, reducing the number of people in a vehicle and that they would also wear face coverings or face masks. And of course, always using frequent cleaning of high use areas, whether it's a lunchroom, which would be a shared facility, and particularly vehicles such as motor pool, police cars are being used between shift, always have to be cleaned before and after use. A special note on respirator requirements. Those individuals who are not really familiar with respirators or wearing them, who are considering wearing an N95 respirator, that is a tight-fitting filtering respirator. And under the OSHA standard, which is 1910-134, that requires a written respirator program. And that written respirator program requires that every employee have a medical clearance, filling out a medical questionnaire. It's basically an OSHA format form that has to be reviewed by a medical professional. Fit testing is also required initially and also annually. So even though you have the initial fit test, within 12 months you have to have another fit test. Training is required, showing how to don and doff, putting on and off the respirator. Also showing how to fit test the respirator, to do self-testing to make sure it fits correctly, and it requires inspection by the employee. Also, there's record-keeping requirements, documentation about the respirator, and basically as far as what type the person is wearing, when they've had fit testing, and so on. They're medical as well. It also requires that a supervisor basically do some oversight and make sure that the equipment is inspected properly to make sure there's not wear and tear, misuse, improper storage, etc. Also want to mention too, in some cases where an N95 respirator is not required, an employee has the right to wear an N95 respirator, but they must sign the voluntary use form, which is an OSHA form, Appendix D. And this basically clarifies the employee some of the restrictions associated with wearing a respirator and gives them some information that they sign off on. And that's part of your record keeping. One note about medical clearance: if an individual has the medical questionnaire reviewed by a medical professional and if they have too many risk factors, they can be required to have a complete physical. So that's another aspect of the respirator requirements, would be that some individuals may have to have a full physical. Some special work precautions may include things in your workplace, such as, again, we talk about assuming everybody is infected with the disorder, but also whenever someone is riding in a vehicle, particularly those that you're not familiar with. You may be transporting a patient, for example. You may have to, well, you should disinfect that vehicle between use. So like for an example, an ambulance for transport, after transport is complete, at some point should be cleaned appropriately, and sometimes using a aerosol sprayer would be an effective way of doing so with a proper chemical. So disinfecting and use of vehicles that are shared. Police cars come to mind, for example, and of course motor pool, which you mentioned previously. Also, if you're using equipment that's shared and is not disposable, they should be wiped down and cleaned as well, so that when they transfer from one person to another, they've actually been effectively sanitized. Disinfecting workspaces where an individual has been detained, or perhaps the back of a police car, or other areas that should be cleaned and sterilized. Not sterilized, but sanitized. Also, another control would be limiting patients or visitors to designated areas. By restricting their movement, you may reduce the potential for infection and also control the amount of air droplets. And of course, they should be wearing a face covering. Some other special work precautions include pre-screening employees prior to workplace entry. This may include temperature checks. Also, it includes asking several questions required by VOSH about whether somebody has any indications of such as fever, aches and pains, discomfort, those things that may indicate they may have the onset of symptoms of COVID-19. So the same thing would be required of pre-screening patients prior to entry, just like hospitals. This might be something you would see at CIBH, where they do sometimes have specific medical treatments that require interaction with a patient. Quarantine. We may have situations where we have new residents coming into juvenile detention, or they could be coming into the jail. In those cases, they don't mainstream immediately, as typically they don't. But in this case, they might have a longer quarantine to make sure they have no symptoms of COVID-19. Other precautions would be family-style meals. Those, like in the fire stations where you have 24-hour shifts, where you used to eat together family-style, now you cannot, because obviously you can't dine and wear a mask. So now those individuals have to be separated, get your food, and move outside elsewhere. Or maybe to a very large room where you could actually be very well distributed. So quite a challenge for people who are on 24-hour shifts, because typically where you share space, now you basically have to find methods to actually isolate each other. Talking about the infectious disease control plan, the city does have an infectious disease control plan. It is required for those individuals in the high-risk category. And so part of that plan requires that each department have a health safety officer. The health safety officer will oversee and monitor compliance of the work practices, those things that are developed under the hazard assessments. Those hazard assessments or job assessments are determined by your risk classification. So in this case, we're talking about high risk. So your health safety officer in your department is really going to focus on your particular exposures and your particular work requirements and make sure those are enforced. They also will work with contingency plans. The city has a number of contingency plans, and those are basically referenced in the infectious disease control plan. They become active whenever there's a significant change of circumstance, such as if the pandemic takes a different turn, may require other additional requirements. The other part of the requirements of the health safety officer having oversight is to make sure that the control measures are basically effective. And we're talking about things like personal hygiene, housekeeping practices, disinfection of surfaces and managing visitors, et cetera, et cetera. They also make sure that the employees are doing the self-assessments. Again, for high-risk employees, the self-assessment is very important, that people don't come to work sick, but also that we have the additional workplace screening done so that when employees prior to entering the workspace are actually screened to make sure that we're not bringing somebody in who may have the COVID-19 disease. Employee participation is very important, and that's part of what the health safety officer will do, is try to seek information and input from employees. So if they have suggestions or recommendations, they can provide feedback on the PPE selection, administrative controls, or different work requirements. And again, we're always trying, particularly from the health safety standpoint, encourage employees to communicate their safety concerns. Now let's talk about some case studies. I think these are interesting because they're a little bit interactive, even though this is a PowerPoint presentation. But let's look at case study number one. This is actually a medical response that occurred in April of this year, pretty early in April, and the photograph was actually in the newspaper. This was in Roanoke County, Virginia, where a bicyclist actually collided with a vehicle, kind of a right-of-way issue. So Roanoke County Fire Department responded to the injured. And if you take a look at the picture, try to see what you think is most important about their protective measures they're taking. What are the good practices that you see? You can see the patient actually has a mask. You can see, I know the slide might be a little difficult, but the firefighter on the left of the screen has basically a face covering. He also has a pair of gloves. And you can see the firefighter to the right has a face covering, and he's actually putting in data. So take a few seconds to look at that and see if you have any additional suggestions. So the point here on this slide, this was in April of this year as we were learning more about the virus and how dangerous it could be. All right, so here's where we're looking at additional personal protective equipment. Now that we've been more experienced with the virus, our public safety folks out there in the field, particularly the fire department, have learned to take more precautions. So what you might see today would be face shields, soft cap that might be absorbent. So I would think there would not be a soft cap when you're this close to an individual who may breathe and potentially have some aerolization of droplets that could actually be absorbed into the cap. You may have disposable dressing gowns. N95 respirators, now that they're more available for public safety, disposable gloves. And there may be some additional things that you might have as part of your assessment that might protect you as an individual. What's particular about this slide is that the person doesn't have any respiratory symptoms. It's basically a physical injury. So the previous assumption that somebody who's not in any type of respiratory distress is not someone that could be infected is basically false. So this could be a asymptomatic person who could still basically transfer the disease. So we see from early experience that as we know more about the disease, we've learned that more protective factors are required. And that's why the VOSH standard became so important. It's emphasizing protection to employees. This is another case study involving a police officer that was in Goldsboro, North Carolina. The police officer was traveling down the road, was heading to lunch. He actually noticed a person who was homeless on the side of the road. And as he thought about his lunch, he thought about her lunch. And he actually had a nice idea of going up, picking up a pizza, bringing it and sitting next to the individual and splitting it. Now this happened around March of this year. And again, this was a newspaper photo. So looking at this, think about some safety recommendations you might have for this scenario. Okay. All right, so here's some recommendations. As you can see, he's sitting pretty close. Again, this was March, so he probably wasn't quite aware as how potent the virus was as creating the COVID-19 disease. But the key things should have been maintain at least 6 feet. You see they're obviously not wearing masks here. Do whatever he could to limit physical contact, look for symptoms, may consider gloves. If he's interacting with the individual, certainly a face mask within 6 feet. Maybe even offer a face mask if he has an extra one with the individual, if he's going to have a prolonged conversation with him. One thought that he could have done perhaps is recognizing that an individual could be infected with the SARS virus and have COVID-19 is to get 2 separate containers. One that he could have put halfway to the individual and then have one for himself, maybe even pass a drink over that was bottled. Again, putting in the midpoint between the two and then stepping back about 6 feet or more where they both could have conversed and actually ate and talked to each other. But a really nice nice act of kindness. Case study number 3. This is a nurse giving a typical flu shot during the flu season. This is about a year ago. So as you can see from this photograph, nobody has any face coverings. You don't see any PPE. And so you need to think to yourself, what should the person be wearing as far as protective equipment during this period, now that we know that COVID is so dangerous a disorder. So here are some PPE requirements would be suggested: a face mask, possibly a dressing gown, could be some body fluid issues, disposable gloves, which she is seemingly wearing, and the patient definitely needs a mask. So generally anybody doing medical interactions such as this probably needs much more personal protective equipment. A little comment down here, think about dental hygienists. They've been dressing significantly with personal protective equipment for years, primarily because of blood pathogens. But now what they've been wearing is very prudent for COVID-19. And now in this photo you see somebody wearing goggles. They'll probably be wearing a face mask, doing something invasive as far as dental cleaning. And also they might be wearing an N95 respirator because they're so close to the individual. So even though they have a lot of equipment here, their hazard assessment requires them to step up to wear something more effective. It's very critical during this time period too to understand the availability of the Employee Assistance Program, the amount of stress that people are under because of isolation, lack of family contact, reduced social activities. People may also have financial issues because someone in their family has lost the ability to work full-time or maybe even lost a job. So there's a lot of stressors out there caused by the COVID-19 issue and SARS. We do, through the city's program, we have a EAP program through Bond Secures, and they offer up to 8 visits to employees, whether they're full-time or part-time, and it's free to employees as well as their family and dependents. So it's a very good option if someone feels significant stress caused by the COVID situation. And the contact information is at the bottom of the slide, both the numbers as well as the website. So a little summary of the training. We talked about the general information about SARS and COVID-19, methods of transmission. We talked about work practices identified by job tasks. We talked about the requirements to determine engineering, administrative, and PPE requirements, the documentation that's required via hazard assessments, which actually have to be signed off by your health officer. We talked about other policies and procedures, and we talked about how important it is, as part of the standard, is to make sure we have opportunities for employee feedback. Employees are encouraged to give the supervisors feedback on this training and any other necessary safety concerns. We also want to talk about the cycle of training as we're about to close, is that typically when we do training and we think of a hazard assessment, we start with evaluation. And from that evaluation, we identify certain critical needs based on what hazard exposures are specific to a certain job task. And then we design the training, but then also we deliver the training, and that's very crucial. But at that point, it's not over, because typically with training, you need to go back to do an assessment, because now you need to see how effective is the training. So that's always done. So even though you've done it once, and maybe at some point you come back and do an assessment and you do modification, you have to do that cycle all the way around again and make sure that you've identified all the needs, done your training design properly, you've got your delivery, and then again, you need to periodically see if your training is effective and if what you've done for hazard assessments, abatements, mitigations are actually working. Other training materials we have too is that or training opportunities are when there's changes in the workplace. Perhaps if there's something about the SARS virus or the COVID-19 disease that we learn that requires additional protective measures, we need to execute and take those measures, adjust our hazard assessments. We may have some change in the city plans or the way of cities doing business that actually affects the interaction with citizens. And anytime that an employee seems to need retraining, evidence of that might be where they're not able to follow the guidelines or they're having difficulties with the personal protective equipment, then we need to have retraining for those opportunities. And finally, here's a question for you. Will the standard become permanent? It currently right now is an emergency temporary standard. There is a process currently now to make comment, which is closing, to make this a permanent standard. Due to the high incidences of COVID-19 that's continuing, it's also projected that the pandemic will impact 2021. It appears very possible this will be a permanent standard, and it may be a blueprint standard for all pandemics in the future. So the expectation is this standard will probably be with us for some time. Reference documents. There's numerous reference documents that you can follow up with that are in SharePoint and Human Resources. The City Manager's Directive, the Infectious Disease Preparedness and Prevention Plan, the COVID-19 Exposure Guidance Flow Chart, and the City Implementation Plan to comply with the VOSH standard. Those are all in SharePoint and Human Resources. Now, if you have any other questions, you can contact your department director, your health officer, risk management, and human resources. So if you have any questions, feel free to contact them. You can also contact me. My number is 382-6377. And if I could send you information or documents, please feel free to contact me. Thank you.